If you're using your electric toothbrush like this, you might actually be damaging your teeth and gums every single day, even if you think you're doing everything right. And what's scary is that most people who do this genuinely believe they're brushing correctly. I see this all the time. Patients who brush regularly use an electric toothbrush, buy good toothpaste, and they still end up with gum recession, sensitivity, and exposed tooth necks. So before we talk about what you should do, we need to talk about what you need to stop doing first. So, electric toothbrushes don't ruin teeth. Instead, people ruin their teeth with electric toothbrushes. These brushes are extremely effective tools, but only if they're used the way they were designed to be used. If not, they can speed up damage instead of preventing it. And the number one problem is not the brush itself, it's the way people use it. This right here is one of the biggest mistakes: scrubbing. A lot of people take an electric toothbrush and use it exactly like a manual brush. Back and forth, side to side, with force. But you need to realize this. An electric toothbrush already creates thousands of tiny movements per minute. When you add manual scrubbing and pressure on top of that, you massively increase force and friction at the same time. And that combination, force plus friction, especially together with abrasive toothpaste, is what causes damage. Real damage. Over time, this leads to enamel wear near the gum line, gum recession, and eventually exposed tooth roots. That's when people start feeling sharp pain from cold air or cold drinks. And they often think something is wrong with their teeth. But in reality, it's mechanical wear caused by wrong brushing technique. Another huge issue is pressure. Most people brush like they're trying to scrub something clean, but plaque is soft. On the other hand, enamel is hard, but it's not indestructible. If plaque doesn't come off easily, the problem is almost never pressure. The problem is technique, and brushing harder doesn't solve that. It just increases mechanical stress on the most vulnerable parts of the tooth. Luckily, there's an easy way to tell if you're brushing too hard. If your toothbrush bristles flatten or splay out after a few weeks, you're brushing too aggressively. That's not normal wear, that's too much force. An electric toothbrush needs surprisingly little pressure to work and clean properly. This next mistake is the mistake that causes long-term problems, and most people don't even realize they're making it. When you brush straight onto the tooth surface, like this, you completely miss the area that matters most: the gum line. That's where plaque builds up first. That's where inflammation starts. That's where gum recession begins. At the same time, brushing straight like this increases mechanical wear right at the tooth neck, the most vulnerable part of the tooth. So plaque stays where you need to remove it, and damage happens where you don't want it. But this doesn't happen overnight. It starts slowly. Gums pull back little by little. Teeth start feeling sensitive. Cold drinks suddenly hurt. Many people think this is just aging, but it's not. In most cases, it's technique. And the frustrating part is that people are doing this every day, thinking they're being disciplined and healthy. So, in the next part, I'll show you exactly how an electric toothbrush is meant to be used, and how small changes completely change the outcome. Now, let's flip this around. If scrubbing, pressure, and wrong angles are the problem, what does correct electric brushing actually look like? The biggest mindset shift is this. You don't brush with an electric toothbrush. You just place it in the right spot at the right angle. And that's it. Your job is positioning it correctly. Not force, not scrubbing. Electric toothbrushes are designed to do the movement for you. Your hands are only there to guide it. This next one is the single most important adjustment. Instead of holding the brush straight onto the tooth, angle it slightly toward the gum line, about 45 degrees. That means half the bristles are on the tooth, half are gently touching the gum margin. But why does this matter? Because plaque doesn't just sit on flat tooth surfaces. It accumulates right at and slightly under the gum line. That's the area you can't clean properly if you brush straight on. When the brush is angled correctly, the bristles naturally slide under the gum edge, without drama, without force, and without damage. Okay, now, what your hands should actually do. Once the brush is in the right position, this is where most people overdo it. So remember to keep it simple. Don't scrub, don't saw back and forth, don't press hard. Just simply hold the brush in place for a few seconds and then move to the next tooth. That's it, nothing more, nothing less. Think of it like this. You're guiding the brush from tooth to tooth, not brushing them like a surface you're trying to polish. If you feel the need to help the brush by moving it more aggressively, that's usually a sign you're either pressing too hard or not trusting the tool. Now, on the upper teeth, angle the brush slightly upward toward the gums. On the lower teeth, angle it slightly downward. It's the same principle, just mirrored. This ensures the bristles reach where plaque actually forms instead of just skating over enamel. And for the lower front teeth, on the lingual side, turn the brush vertically. That vertical position lets you get the correct angle on those narrow front surfaces where plaque builds up easily and is often missed. Most electric toothbrushes have a built-in timer, usually 2 minutes total, with 30-second intervals for each quadrant of the mouth. That 2 minutes isn't random. It's usually the minimum time required to clean your teeth properly with precision, especially if you're moving tooth by tooth instead of scrubbing. Personally, I often brush 2.5 minutes, sometimes even 3 minutes, especially if I'm being very deliberate around the gum line. If your toothbrush has a pressure sensor and it lights up, that's not just a suggestion, that's direct feedback. It means you're applying more force than necessary. And remember, plaque removal doesn't improve with pressure. Damage does. If you tend to be heavy-handed, a pressure sensor is one of the best features you can have. Those 3 changes alone can dramatically lower your risk of gum recession, sensitivity, and long-term enamel damage. And if you want to learn the flossing technique that actually cleans between your teeth without damaging your gums, watch this next video right here, and I'll see you there.